What are the differences between amniocentesis, NIPT, and CVS? Imagine trying to find out if your baby has any genetic concerns before they are born. There are different tests for this, each with its own way of working. Let's explore how they differ so you can understand which might be right for you. First, non-invasive prenatal testing, or NIPT, is a simple blood test. It only needs a blood sample from the mother and can be done as early as 10 weeks into pregnancy. It looks at tiny pieces of fetal DNA floating in the mother's blood to estimate the risk of conditions like Down syndrome, trisomy 18, and trisomy 13. Since it is just a blood test, there is no risk to the baby. However, it only gives a risk estimate, not a definite answer. If the results show a high risk, your doctor might suggest more testing. Chorionic villus sampling, or CVS, is a different kind of test. It is an invasive procedure that takes a small sample of placental tissue. This tissue is collected either through the cervix or the abdomen using a thin needle. CVS is usually done between 10 and 13 weeks of pregnancy. It can give a definite diagnosis of genetic conditions because it analyzes the chromosomes directly. But because it involves inserting a needle into the uterus, there is a small chance of miscarriage, about 1 in 300 to 1 in 500 procedures. Amniocentesis is another invasive test, but it is done a little later, usually after 15 or 16 weeks. During this procedure, a needle is inserted through the mother's abdomen into the uterus to collect a sample of amniotic fluid. This fluid contains fetal cells that can be tested for genetic abnormalities. Like CVS, amniocentesis provides a clear diagnosis, but it also carries a small risk of miscarriage. It is often used when more detailed genetic information is needed, or if earlier tests suggest a concern. To sum up, NIPT is a safe, early screening test that estimates risk but isn't definitive. CVS and amniocentesis are diagnostic tests that give clear answers but involve small risks. CVS is done earlier in pregnancy and analyzes placental tissue, which sometimes can show differences from the fetus. Amniocentesis is performed later and tests fetal cells directly, often providing more accurate results. Knowing these differences helps families and doctors choose the best test based on timing, safety, and the kind of information needed for family planning and health.